Welcome, Mr. Chan and Julie. I know this is a difficult time for you and your family. I'm happy to answer any questions you have about hospice.
Thank you so much. We recently found out that my father has terminal cancer. His doctor says he has only a few months to live. We learned from our friend about hospice the other day. We came today to get more information about it.
Is this service expensive? I don't want anything too expensive. I don't want to burden my family, and I don't want to die any sooner than I have to.
Yes, Mr. Chan, I understand your feelings. Hospice does not hasten death. On the contrary, it encourages and helps the patient to live his remaining days to the fullest. It helps the patient live in the comfort of his own home, under the loving care of his family. Let me explain in detail what hospice is all about. Hospice is a healthcare benefit program designed by Medicare for patients who have a terminal illness with a life expectancy of 6 months or less if the disease runs its normal course. The service of hospice is free to Medicare and Medicaid beneficiaries. To be eligible for the free hospice benefit, a patient must fulfill the following requirements. 1, he has Medicare or Medicaid health care insurance. 2, the patient has 2 physicians certifying that he has a terminal illness with a life expectancy of 6 months or less if the disease runs its normal course. And 3, the patient and family agree not to receive treatment for the terminal illness anymore and understand that hospice does not provide medication or any treatment to treat the terminal illness. What hospice does is it encourages and helps the patient and family to look at life and death positively, to understand that it is a normal process so that both parties can let go when the time comes. By letting go, the patient can die comfortably and peacefully.
You mentioned about not receiving any treatment. Are you asking us to give up?
Julie, hospice does not mean giving up. On the contrary, hospice encourages and helps you to support your family member, to help him do what he wants, and to finish his unfinished business, so that he can live out his remaining days to the fullest. With the family's support, the patient will be able to die with dignity and peace, and without the fear of being alone and abandoned.
So my father stays at home? Who's going to take care of him?
You don't have to worry. Once a patient is accepted into a hospice program, there's a team of hospice professionals who will visit the patient at home to help take care of the patient. This hospice team includes the patient's attending physician, the hospice medical director, hospice registered nurse, hospice aide, medical social worker, chaplain, or spiritual counselor, and volunteers. They work together to assess the patient's condition and set up a plan of care, then meet regularly to discuss the patient's condition and update the plan of care as needed to meet the patient's needs. The hospice aide will help with the patient's personal care, such as bathing and shampooing, changing clothes, and getting the patient in and out of bed. She also teaches the patient's caregiver how to do these things.
Wait a minute. How does my family know how to take care of me? What about the doctor?
As I have mentioned, the hospice team members will visit and provide services for you at home. The attending physician is responsible for treatment and medications for pain control and symptom management. By the way, prescription medications related to the terminal illness will be delivered to your home for free. The registered nurse will visit the patient regularly to assess the patient's condition and report the findings to the attending physician, carry out the physician's order, and coordinate medication delivery. She will teach the family and caregiver how to use the medications and other methods of pain and symptom control to maximize comfort.
But what if there's a problem or we have a question?
Don't worry. You may call hospice any time, day or night, even in the middle of the night if you have a problem or question, because we have a registered nurse on duty around the clock to answer phone calls. If the nurse finds that the problem cannot be resolved on the phone, she will make a home visit as soon as possible, even in the middle of the night. Since we have such a good 24-hour phone service, you do not need to call 911 or send the patient to emergency room anymore. If you send the patient to the emergency room or hospital for treatment, the aggressive treatment will only prolong the dying process, adding unnecessary suffering to the patient. In fact, the Medicare hospice regulations state that the hospice patient and family must agree not to call 911 or send the patient to the hospital, but to consult with hospice instead. Since the hospice team has been taking care of the patient, they understand the need of the patient and family and will be able to provide immediate help.
I'm still concerned about my family members taking care of my father. After all, we don't have medical training. How do we know how to attend to his personal needs?
Regarding this matter, the hospice aide will come to the home once or several times a week. The frequency will be determined by the registered nurse. The hospice aide will help with personal care, such as bathing, shampooing, change of bed linen and clothing, feeding, and getting the patient in and out of bed. She will teach the family members and caregiver to do these tasks and make sure you know how to take care of your father.
It sounds like a lot of people are coming in to help. Who else is involved?
The medical social worker.
Right, that's what I want to ask.
Well, Mr. Chan, as I'd mentioned before, the hospice team members will come to your home to help you and your family. The medical social worker will determine whether or not the patient has any financial difficulties and help him apply for the necessary benefits. She helps the patient attend to any unfinished business and live his remaining days to the fullest. She talks to the patient and family, helps them look at life and death in a positive light. She can also assist with funeral arrangements. The frequency of her visits depends on the needs of the patient. Another core member of the hospice team is the chaplain or spiritual counselor. He will discuss matters with the patient and family regarding any emotional problems and spiritual issues. If the patient or family has a religious belief, he will try to resolve their problems based on the ethics of their religion and connect them to that community. But if they do not have any religious belief, he will only discuss the general ethics of life and death to ease their worries and fear of death.
It sounds like the family might need bereavement counseling after the patient has passed away.
Julie, we agree that the patient and family do need bereavement counseling. The chaplain will provide counseling as soon as the patient is admitted into hospice. He will help the patient resolve his worries and conflicts. He will go through with the patient and family regarding the signs and symptoms when death is approaching, what to do and what to say to support the dying patient so that the patient can let go and die in peace. When the patient has passed away, the registered nurse will come to the home to pronounce that the patient is dead. If the family wishes, she will contact the funeral home to have the body picked up. After the patient has passed away, the hospice bereavement counselor will continue to contact the family for a period of at least 1 year to ensure they come out of grieving and return to normal life.
Well, what happens if my family has to attend to other business and leave me alone for a short period?
Mr. Chan, you don't have to worry about that. Hospice volunteers would be more than happy to keep you company and run errands for you.
I have not decided whether to accept hospice or not. But what if I sign up for hospice? And can I change my mind later on?
That is not a problem. You can revoke hospice at any time. Once you have signed a revocation form, you will resume regular Medicare coverage through your health insurance for your terminal illness and its related conditions. But I want to let you know that when a patient has a terminal illness, he usually does not get priority treatment at the hospital. The hospital focuses on aggressive treatment, trying to save and prolong lives. Hospice believes that this only adds unnecessary suffering and prolongs the dying process of a terminally ill patient. Hospice is different because it focuses on comfort care. Hospice helps the patient to live his remaining days to the fullest and to die with dignity and peace when the day comes. Isn't that a much better choice? I've helped many patients and their families through hospice care, and what strikes me the most is the dignity, peace, and love that patients experience as they face death.
What if I want hospice care, but I don't want to die at home? Is that possible?
This can be arranged. We generally encourage our hospice patients to stay and die at home, a place that they are most familiar and comfortable with. As people face death, being in one's own home and surrounded by loved ones greatly reduce their fears of being alone and abandoned. But there are some alternatives if you don't want to die at home. If a patient has Medicaid insurance, he may go to a skilled nursing facility to live and die if a bed is available. If a patient does not have Medicaid, hospice will cover the fees for no more than 5 days at a skilled nursing facility or hospital when death is imminent. Of course, the family can also pay a skilled nursing facility as a private paid resident.
You said that hospice only covers those patients who have 6 months or less to live. What happens if the patient lives longer than 6 months?
No problem. The patient can continue to receive hospice care as long as the hospice medical director certifies that the patient's condition is deteriorating. If the patient's condition becomes stable, the patient will be discharged from hospice. When conditions start to deteriorate again, the patient can sign up for hospice again.
I'm not totally convinced about hospice care because we want to do everything possible to save my father. I don't want people to think that we are giving up.
Julie, I understand your feelings. In fact, you were doing everything you can for your father. Remember, as I said earlier, in order to be admitted into hospice, the patient has to be certified by 2 different doctors that he has only 6 months or less to live with no possibility of a cure. If you help your father sign up for hospice, you are helping him to maintain a quality of life at the comfort of his own home, surrounded by his loved ones. He will be able to live out his remaining days to the fullest and die in peace and with dignity. We think this is the best thing that you could do for your father.
Most Chinese people do not want to mention this, but according to Chinese thinking, isn't it bad luck to have someone die at home?
I have heard of this. Let's look at it this way. If a patient was treated with compassion and dignity and was able to leave this world peacefully, wouldn't the spirit be a good and thankful spirit that would bless its loved ones? Hospice will also have a bereavement counselor who will continue to contact the family for a period of at least 1 year after the patient has passed away, to help them cope with the loss of their loved one and to ensure that they return to normal life.
Thank you very much for answering all of my questions today. I am not afraid of dying, but I don't want to suffer, and I don't want to leave a lot of medical expenses to my family. Hospice sounds like a good choice, but I need to discuss it with my family before making any decision.
Mr. Chan, this is a good idea. Here is some information on hospice and my business card. You can share it with your family. Give me a call after talking it over with your family, so we can set up another meeting with you and your family to discuss why hospice is so important to a terminally ill patient. Let them know what your wishes are so that they know what to do.
Thank you very much.
Thank you very much.
You're welcome.